Hello, my name is Neil Baum. I'm a urologist in New Orleans and on the clinical faculty at Tulane Medical School. I am trying to bring to you 5-minute videos on some ideas and suggestions to enhance your urologic practice. These are going to be very short, brief videos that I think will have some ideas that can easily be implemented into any urologic practice. Today, I'd like to talk about ergonomics and how that impacts nearly every urologist in America, or anyone who is practicing urology doing surgery. You know, there are occupational hazards for urologists. Those include infectious diseases, burnout, and there's also an occupational hazard of back and neck pain. It appears that back and neck pain impact nearly half of all urologists and all surgeons, with an economic impact of over $25 billion a year. So why do urologists suffer from back and neck pain? Primarily, this has been a result of the introduction of minimally invasive surgery, laparoscopy, and robotic surgery. And I have been in practice for over 40 years and have noticed that there have been no significant changes in operating rooms or operating room tables since I've been in practice for over 40 years. I think if you look at this slide, you don't need to be a kinesiologist or a movement expert to understand that the stress on the back of the surgeon on the right side is going to be significantly greater than the surgeon on the left side. A surgeon on the right side in that position is certainly, after several years of standing like that and looking in that position, is going to have neck and back pain. I'd like to offer you 8 suggestions on how to reduce the incidence of back and neck pain for urologists. First of all, the position of the monitor. If the monitor is above the horizontal or above eye level, this results in neck extension, and for prolonged periods of time is going to result in neck pain. Ideally, it should be 15 to 30 degrees below the horizontal. So if possible, when you are using video mounted screens, have these screens placed just below eye level, and that will take off the tension and pressure on the neck that is, if it's not and it's above, it will result in extension and production of neck pain. Second is the importance of patient position. Try to place the patient as close as possible to the surgeon. I know when I have placed patients in the flank position, oftentimes when I'm on the side of the table, I'm having to bend over and to flex my back, and for long periods of time, this can result in back and neck pain. Number 3, it's okay to take a break, especially if these are long cases. Every 60 minutes, it's okay to take a 30 to 45 second break, and no study has shown that there have been adverse outcomes if a surgeon sits down for a few seconds, stretches his arms and shoulders, and takes a brief break. Number 4, change position and use a footrest or a foot rail. These are inexpensive. ask the operating room to provide it or have your own, and place your one foot alternating back and forth on the footrest. Number 5, for robotic surgeons, have a chair with a sternal support so you're not bending over the entire time during the procedure. This is a very inexpensive way of taking pressure off of your back. Number 6, avoid eye fatigue. When the operating room has to change the source of lighting, be sure to request a system that allows the surgeon to control the intensity of the lighting on these new lighting systems. There are also goggles or glasses that you can get that have anti-glare lenses that will protect the eyes from eye fatigue. Another simple solution to avoiding eye fatigue is request instruments that have brushed steel instruments instead of polished steel that have a significant glare associated with the polished steel. If you have a problem of discomfort in the lower legs and with edema after standing for long periods of time, consider using compression stockings, inserting gel insoles in the back of the shoes that will help, or using anti-fatigue floor mats that are so easily obtained that will take less pressure off of your lower legs and prevent the peripheral edema. Number 8, and the last one, is to consider using music in the operating room. Now you may be asking me, Neil, what does using music in the operating room have to do with ergonomics? The truth be told, absolutely nothing. I just included this as a nice suggestion for the urologist to offer the anesthesiologist, the nurse, and especially the patient, to ask the patient before induction of the anesthetic what music they would like. On several occasions, patients, after they woke up from the surgery, mentioned what a nice gesture that was. Simple idea, but it's not always that the surgeon or the urologist should control the music. So, in summary, I point out to you that as a urologist, we are at an increase in risk for back and neck pain. I provided you with some ergonomic suggestions that are very simple, easy to implement, that may alleviate or reduce the risk of back and neck pain. So my take-home message is, don't let back pain put a drain on your career. Take a few of these suggestions to heart and see if your operating room or your ambulatory treatment center can implement them into your operating room. I would like to hear from you. If you have any comments or suggestions or ergonomic ideas, please contact me at the email or phone number below. I look forward to communicating with you again for these 5-minute videos on ideas to make your urologic practice more enjoyable and more productive. Thank you.